I'm not concerned about HIV.
Isn't HIV and AIDS the same thing?
Why would I get tested for HIV? I'm clean.
I'm not concerned about AIDS. I'm not a gay white man.
There is an epidemic in the community, fueled largely by silence.
I knew it existed, but I too thought that it was a gay issue.
Fact, the African American community is disproportionately impacted by HIV and AIDS. Although blacks make up only 12% of the population, almost half of all new HIV/AIDS cases are in blacks. Of all HIV and AIDS cases in Northern Virginia, 41% are black men, 61% black women, and 69% of new HIV and AIDS cases are black youth.
My first thought when I got my positive test result was, repeat that, because it was something that I wasn't expecting to hear.
Fact, 3 out of every 5 Virginians infected with HIV are African American. 1 in 16 black men will be diagnosed with HIV at some point in his lifetime, along with 1 in 30 black women.
I was totally ignorant of the virus and its effect.
Silence surrounding HIV and AIDS among African Americans has allowed the disease to spread, causing growing pain and suffering to individuals, their families, and the greater community. Andrelia Keller, devastated to learn, only after his death, that her father died alone of AIDS, too ashamed to tell anyone. Bernard Jackson, a straight, married man who was unknowingly infected with HIV by his wife. Chris Barnhill, born with HIV, the virus passed on to him by his mother.
You can catch HIV whether you're 0 to 100 years old. Babies are being infected with HIV, and HIV don't care. It doesn't care who you are. If you put yourself at risk, you can contract HIV, and I think that we just separate it and we stigmatize it even more when you put it in this certain category of HIV in the African American community, HIV in the gay community, HIV in the blue community. I think that we're stigmatizing it itself, and it makes people be afraid because you're putting the focus on one certain gender, class, or race.
Fairfax County ranks second in the state for new HIV/AIDS cases, and Virginia, Maryland, and the District of Columbia rank among the top 15 in the nation.
I thought HIV and AIDS were the same thing.
Fact, HIV is a virus that weakens the immune system. AIDS is the collection of illnesses caused by the HIV virus and a depleted immune system.
I know HIV is a death sentence.
Fact, people with HIV are living longer today than ever before. Medications and treatment programs allow infected people to live normal and productive lives.
I would know if someone had HIV. It's obvious.
Fact, a person who is infected with HIV may not show symptoms for up to 10 years. However, they could be infecting others with HIV during that time.
Now, why would I go and get tested for HIV? I'm clean.
Why would I get tested?
Fact, the only way to know if you are infected with HIV is to get tested. Knowing your HIV status helps you to prevent spreading this virus. And if you are positive, getting early treatment allows you to live a longer, healthier life. Free, confidential, and anonymous testing is available at local health departments.
There are a lot of myths out there about how HIV spreads. And so step one is to get the facts straight. And then secondly, to know how HIV really is transmitted so that people can take the necessary precautions.
Fact, HIV cannot be transmitted through casual contact or by breathing the same air as an infected person. You cannot get HIV from a toilet seat or from sharing a baptismal pool with an infected person. You cannot get HIV from your pet or insect bites. You cannot get HIV from sharing kitchen utensils with someone who is infected. HIV is transmitted through blood, semen, vaginal fluid, and breast milk. HIV is not transmitted through saliva, tears, urine, or sweat. Engaging in risky behaviors such as unprotected anal, vaginal, or oral sex, having sex with multiple partners, and sharing needles increase your chance of becoming infected. Know the ABCs of HIV prevention. Abstinence for youth until marriage is a healthy choice. Be faithful to one partner. Correct and consistent use of condoms if abstinence and fidelity are not a choice. And know your partner's sexual history and HIV status. If he or she won't tell you, then don't have sex with him or her.
A lot of things I didn't know. I didn't know that, use of a condom can save your life. I just didn't know those things at that time. And being married, I always thought that that was the safe zone.
One of the things that we think is like, oh, if I have HIV, I don't want to know about it. But when you find out it's too late, you already have AIDS and you're pushing death.
Race alone does not make one more likely to become infected with HIV. But the HIV epidemic continues to silently spread in the African American community. Why? Addressing the problem will require understanding the cause.
I just really think denial is just such a big part of this. It can't happen to me. We don't do this. Look, they got these wonderful, powerful drugs now. What's foremost in a lot of people's minds is how did they get it? And so often it's associated with homosexuality. And in the African American community, even though homosexuality exists, there's still this reluctance to talk about it, to deal with it.
They don't want to talk about it because it's still connected as those people's disease. And they just don't talk about it like they should. I mean, even with my own family, it's not talked about.
Well, by denying, we stop the flow of information, and we stop ourselves from engaging to find out more information about this. We also do not provide opportunity for us to provide love and care to those who are affected with AIDS and HIV. And we do not provide a conduit by which those who are infected can come and find support and love. And so denial is a horrible thing.
Reverend Dr. Kenny Smith is the chairman of the newly formed Northern Virginia Clergy Council for the Prevention of HIV and AIDS. Members of the council have acknowledged this epidemic and have mobilized to increase HIV awareness. Working with a number of community partners like the Fairfax County Health Department, the clergy hope to break the silence with HIV in their communities and stop the spread of this disease.
It is one of those subjects that's considered to be discussed in closed environments as opposed to open discussions. And because of that stigma, it isn't a conversation that we find in an open forum unless there are opportunities to draw from individuals. That, I think, is the major cause for the reserve on talking about HIV/AIDS.
Most people, if they knew this epidemic and if they knew the devastation of this disease and how horrible it is for someone to die from this disease, I think they would make better decisions. And so we're hoping that we can provide them with factual information so that they can make better and more healthy decisions.
I think that we have stigmatized HIV so much that people are just scared to go get tested for HIV. You should be able to comfortably go to get an HIV test just as well as you're comfortably going to get a mammogram or a diabetes test or a cholesterol test. It should be on that same level of testing. It's about your health, and people need to be aware that, yes, if you put yourself in those risks, you need to get tested and get treated.
Breaking the silence is going to have to deal with a lot of people pushing aside old ways of thinking about different illnesses that we deal with today. We got to break the silence by talking, communicating with each other, letting people who are dealing with this talk to each other, talk to the communities, let the ministers and the churches understand that we need their support in order to get stronger and remain healthy.
Many members of the clergy have recognized the importance of the church's involvement in combating this epidemic and have embraced their new roles as HIV educators.
Within our community, one of probably the best delivery system within the black community is the black church. And if the church decides to be silent, then therefore this information will not get effectively disseminated within our community. So the church plays an important role, because if you want information to get to the black community, you start with the black church.
It will take all of us to end the HIV epidemic in the African American community. We cannot ignore the problem. Individuals must know the facts. People must be willing to talk openly about this disease. As a result, some members of the faith community have developed HIV ministries to educate their congregations about this deadly disease, and they encourage others to do the same in an effort to end the suffering caused by denial, stigma, silence.
Don't desert your loved ones, because this is the time that they need, yes, they need medical guidance, they need nutritional guidance, but they need the love of their families. They need to know that their families are going to be there no matter what.
The only thing that I can say is that being a very spiritual person, relying on my faith to get through those rough days, it's very important that our churches open their hearts and their doors to being educated about this virus.
By bringing all of the groups together, both those groups within the county who have working on programs such as we are, and the county staff, that we create synergy. And that is, we're able to do greater things together than we are by ourselves.
It's lives, it's productive lives lost. And you know, it doesn't matter what color you are or what ethnic background you are, we all live in communities, we're part of a community. So a loss in one segment of the community is a loss for the entire community.
I believe that we must do something. We have to do something to curb this dreaded disease. The church has always spoken into the context of what is occurring in this environment. And I think this disease warrants that voice. How do we reach the African American community? And the church is that vehicle to do so. It is important that the church get involved and speak.